According to my able clock, it's 9:01. I'm a minute late. I apologize. How's everybody doing? I am sorry. I haven't done this in a while. I got to get back into the swing of things. Apologize here. Greetings. Glad to see everybody. Thanks for joining. I think this is the first Coffee with Carl in 2021. Sorry about that. For those that were with us last year, I did this on a regular basis, and then I got bored. I think y'all got bored with me, and I was boring myself, so we took a little hiatus. But we are glad to be back, and I really, to be honest with you, with all the new stuff going down this week, I wanted to reach out on behalf of the chamber to our partners to say, hey, how are y'all feeling? What's going on? There is a lot to unpack with what's going on with this new Delta variant and with just business in general in Colombia. So this is as much for me to get information from you as it was vice versa. But so I'd like to do a couple things. One, I'll give you a couple points I wanted to hit today, and then if it's all right with you, I really want to turn it over and ask some questions. But obviously, we're at the hospitals in Colombia are at a critical phase with a number of COVID variant patients. It's really scary how quickly this came on before we knew surges were occurring, right? In fact, it was a holiday. 10 days later, we saw numbers spike. Another week later, we saw hospitalization spike. And 2 weeks after that, we saw death spike. So it was kind of a pattern that we could follow for the last year and a half. And now this came out of, for me anyway, I know the professionals probably saw this coming. I did not, but at least at a rapid pace. But we are seeing critical numbers at our local hospitals. And so hold this thought for now, come back, but how is this impacting y'all is a big question. But I'm going to be I was before, I'm even more of an advocate for getting your shots. I'm a breakthrougher. I had COVID last 3 weeks ago. It was no joke. And I'm very thankful that I had the vaccine back in March, because I bet my symptoms were going to be a lot worse than what they were. So if you haven't got your shots, get your shots. Go today, like hang up now, just go right now. It'd be great. But encourage others to do that as well. But it is not for the faint of heart, this Delta variant. So hospitals are peaking out right now. I know they're monitoring numbers daily on whether or not how many more they can take, but we're at a critical number. Even though we've seen a little bit of a drop in new cases statewide, I still think that hospitals, at least in the Midlands, and out of the norm, quite frankly, Lexington County has had more COVID patients than Prisma. Greenville, though, has more patients than anybody right now. They are that's ground zero, it seems like, for the Delta variant. But anyway, it is. I am a little worried. I know if we follow the models of Europe, it looks like we see a tremendous spike and then it comes right back down, which is, fingers crossed, that's what we're going to see. Interesting today, if y'all didn't see this, the FDA approved booster shots for those older Americans for Pfizer, which is what a couple weeks ago Israel has mandated anybody 65 and older to get a booster shot. So I think we'll have to see that as well in the United States. Article yesterday, and I'm not debating the research, I don't know, but it said the Pfizer vaccine was 42% effective against the variant, which is interesting because all thoughts were it was going to be higher than that when they got it, but we're seeing so many new breakthrough cases. It makes me think that maybe a 42% number is right. So anyway, just for that. All right, let's talk about jobs. Job numbers are crazy. I know Tara can tell us this all day long. I don't know any company out there right now that's 100% employed and are happy with their employment numbers or their quality of employment. It is a game changer, this whole COVID thing, and what people are willing to pay for jobs now, incentives. I'm intrigued to see what people are offering, because I think we could learn from each other. When you see signing bonuses every place in the world, advertising for signing bonuses from $500 to $5,000, that's a lot of money. So I'm intrigued to see how this plays out over the years to come. I was very disheartened to see Lizard Thicket close down their Beltline facility just because they don't have enough staff, and they're reshuffling staff to other stores. That's very telling, quite frankly, because I'm in there, well, looking at my waistline a little more than I should, but it is, there are a lot of people like me that are in there, and if they don't have enough staff, then that means it's hitting everybody. All right, last bit of news, and then we'll turn it over, I promise. Census numbers came out. You saw, I think it's interesting how much growth we've seen in South Carolina. More importantly, along the coast, around Charlotte, Greenville, modest gains in Columbia over a 10-year cycle. I think a lot of that was on the front end of the 10 years, not the last end. But anyway, we've seen in the last 8 months, significant jump as well. So we'll digest those numbers and have some better. I'm a geek when it comes to numbers, so I will dig in and we'll have some more conversations at a later date. But most important law change goes into effect this weekend. I am thrilled to no end. Slow drivers get the heck out of the left lane, get in the right lane where you're supposed to be. So little bit of trivia, that law passed in actually 2005. Governor Sanford vetoed it, much to the chagrin of the majority leader, Harvey Peeler, at the time. And they didn't have enough votes to override the governor back in 2005. It's taken 16 years for that bill to come back through the General Assembly and finally pass. I don't know how you enforce it, but after spending a bunch of weekends this summer on interstates in South Carolina, we must be like ground zero for slow drivers in the left lane. Just saying, it's my pet peeve, but I'll get off this soapbox. But there is I think it's $25 fine for driving in the left lane and slow. So be cognizant of that, folks. All right, back to the interactive portion here. How about somebody chime in and tell me what they're seeing COVID, how it's impacting this new round is impacting you, and what, if y'all gone back into new COVID protocols or what?
Hey, Carl, this is Frank Mundy.
Hey, Frank.
Good morning. Good morning, everyone. I work for Stewart. We're a multidisciplinary engineering design firm with offices throughout the Carolinas. We have about 225 employees, obviously an office here in Columbia, which I lead. We have been on a work from home kind of hybrid, I hate to say do what you want to, but kind of do what you want to type environment since all this started back in early 2020, and had modeled our back to work or back to the office standpoint similarly to what Apple had been planning, with a 3-day in the office plan and 2-day kind of a flex plan that was to go into effect the Tuesday after Labor Day across all of our offices. Because of the Delta variant and the surge therein, we have moved that back to the 1st of 2022. So January 3rd. So we're still a voluntary, voluntary basis as far as going into the office, but we are definitely, we're not instituting that if you will, mandatory hybrid model until 2022 because of that. So.
Interesting. I've heard several have that were going back to the 3-2 model are now delaying that month. I know Tim Arnold, our current chair at Colonial Life, has announced they were doing that. They were postponing that until November 1st at the earliest now. I know some of the big banks, Wells, BOA, have delayed their reentry back into the office for phases. I know some have gone back 20% of the time and slowed that roll as well. So thanks, Frank. I appreciate it. By the way, Frank's company was in charge of putting on one hell of a show at Kiowa this summer. Stuart, in charge of all the engineering work for the PGA. So thanks for your hard work. It was fun.
Awesome.
All right.
We're gearing up for Ryder Cup now in a couple weeks, in about a month.
Sweet.
So, yeah.
It may be a little cooler in Wisconsin than it is. Anyway. All right. Who else wants to chime in?
I'll chime in,
All right,
Carl. Obviously, we have continued to do our work. We have about 55 employees here at Oliver Gospel, and we had relaxed all of our mask protocol, but during a gap there. But we're totally back to trying to take care of ourselves and take care of those that we serve. I would say my testimony would be this time, even more than the last time, immediately as the variant has risen, we have seen a great effect, not with those that we serve in our walls, but with our staff and their families. So staff that have families, that have children. Two of my families affected, I know, have young children. Those children are affected. Everybody's down within that home. And there's two other families affected also. So that just is a reality to me. I mean, even when you get a text, as leaders of businesses, and you get that text at night, and you've had a team member struggling with something and they're going into the hospital for treatment. And then knowing that person's brother also was already in the hospital and in ICU. When it begins to hit at home, it's just a reminder that this is no joke, pretty much like you said, Carl.
Great, thanks. Hey, Tara.
Hey, Carl, good morning. So I'm with Apple One. We're sort of a small employer with our staff in this area, but we work with hundreds of clients throughout the South Carolina area. So just speaking on the perspective of what we see with our clients, it is a lot of the same that Carl mentioned. People are pausing or delaying their return to office, even if it was a hybrid model for the larger employers that we work with. For our smaller businesses, we do work with a lot of small businesses that have to be on site. That's where we do feel some of the strain with employees wanting to go back and working on site. Some of them are really getting creative and being adaptive of how they can make it a safe environment. And I feel like that's kind of what the employees are looking for, somewhere that they feel safe and they know their employer is looking out for their safety and their best interest as well. We've seen people do vaccination incentives to help encourage their small team to all get vaccinated. But we have seen people going back to wearing the mask. It's encouraging to see incentives for vaccines. I personally myself, by the time I was eligible for the vaccine, I had COVID. So I wasn't rushing to get it right then. I did go recently and start my process with getting the vaccine before all this flurry. So it's encouraging to see. When I went for my first shot, there were maybe only 3 other people there getting a vaccine that day. When I went back for my second shot 3 weeks later, the lobby was full. So I think it's good to see that people maybe are understanding, people that may have been slower to respond in the beginning, like people are getting vaccinated. Employers are looking out for their employees and trying to listen to what their concerns are. But we see lots of different angles and sides of how it affects everyone. So it's good to see that maybe people are taking it a little bit more seriously.
Yeah.
Columbia College has been in person since last August. We had a full school year with students living on campus. We even did a spring break. We had low numbers. Of course, we're not allowed to mandate vaccines for students because we do receive state money. For faculty, and I'll mention the students, but for faculty and staff, I guess theoretically we're allowed to mandate it, but in practice, over 80% of our staff and over 90% of our faculty are vaccinated. So that's best of both worlds. I didn't have to have the political fight of mandating it. We had good take up. On the student side, we're hovering around 50%. The data are coming in slowly. We already have students back on campus. Some of our athletics programs moved in last Sunday. I'd taken the masks off for vaccinated. Everybody's masks again indoors as of yesterday. And I'm terrified.
Interesting.
Because I've been terrified all summer because as Carl, I hear Carl about the Delta variant hit us, but we knew it was coming. And I guess my optimism is that we've seen more vaccinations in the last 3 weeks than we saw in the 2 months before that. Because I watched that DHEC dashboard every day. But it is. Para was there, and maybe some others were there at the Lexington Chamber on Tuesday, and listening to Todd Augsburger was heartbreaking. And what they're going through at the hospitals is just terrifying. And so, people are dying and being critically ill unnecessarily and voluntarily at this point. And our public policy is counterproductive, and I'm very frustrated about that. So there we are.
Counter to that a little bit, Tom. I agree. Vaccinations are well below, but I think we're underreporting breakthroughs as well, and that's to deter people from not getting the vaccine. I understand that, but in reality, the more we know.
Well, breakthrough makes it sound like we're getting hit by trucks. We all get flu shots every year. People get the flu. We don't go screaming about breakthrough flu cases. It's just disingenuous by people who are lying and causing people to die. I'm tired of it. And we're very frustrated with it. And I'm grateful that in South Carolina, we have, to some extent, navigated it pretty well, but the governor and some other people really need to wake up, because I've got our big freshman move-in is next Thursday, which will be right when the hospitals are full and all of this is peaking. And I'm terrified of what's going on around here.
I was looking for somebody from the hospital. I don't think we have anybody. Hey, Dr. Witherspoon, I'm gonna put you on the spot. I see you on camera. How you doing? You get back next Wednesday.
Next Wednesday
already, but
yeah.
Students go back next Wednesday. Mm-hmm. What you're thinking?
Well, I'm going to agree with Tom on a lot of points that he made. And you all, everybody on this call, of course, has been been following some recent events, but we need all the tools in our toolkit to make sure our students and our staff are where they need to be in terms of safety and so forth. We don't have kids we hadn't started in earnest, but we've got over 100 that are quarantined right now from athletic teams and so forth. And we're in the double digits with cases right now. We know, and again, you all have seen some of the data and information. It's getting younger. Students are hit. You mentioned the hospitals and so forth. So we just need to be able to do everything possible to be as safe as possible as we move forward. We want kids back in, of course, but we need all the tools in our toolkit to make this happen.
Great. Open floor. Anybody else want to chime in? All right. What are you seeing?
Carl,
yeah.
Carl, this is Kim McMahon. I serve as chair of the LCAA, but I also work at the University of South Carolina. Good morning. And following my two colleagues from education, we had our first move-in Wednesday. I would say that we were a very low mask environment for that move-in. Our second one is Sunday, and our third is Monday. And so that descendants very quickly of our USC students will be a game changer prior to our K through 12 and our Columbia College Benedict Allen students as well. So We are not able to use the word require. We've been all getting talking points regarding strongly encourage, have prioritized vaccination and testing, but the community message really is let us get to the point of a percentage of vaccination, and then the incentives begin. They don't begin for a bit of time. And so I echo what my colleagues in education have said, and all of our business owners, that we have citizens who are playing roulette with others' health, thinking that they'll be okay. And I do worry about our students. There's quite a bit of research right now about the COVID classes, and we have 18 and 19-year-olds who have missed out on many of their high school milestones, proms, senior trips, parties, and we're anxious that when they get here and find some freedom, that they will double down on their freedom, and we may have some more challenging situations regarding alcohol use and high-risk behaviors. So we'll all want to be paying attention to that as well. And that would put further strain on any hospital system if we had any kind of transports for alcohol poisoning, et cetera. So I'm not an official representative of USC, yet I run the student union building and see quite a bit of this every day.
Kim, as a parent of a freshman and sophomore in high school and a freshman and sophomore in college, I echo those concerns. I think those are valid, no doubt about it. All right, anyone else?
Hey, Carl, this is Lynn. Good morning, everybody.
Hey, Lynn.
Got a question for Tom Bogart. You mentioned some numbers about vaccination. Just interested to see if that was mandated or that's voluntary information.
We're mandating that people tell us. Well, let me put it this way. Here's the deal. If you do not give us proof that you're fully vaccinated, you're required to have weekly testing. The testing is on campus and it's free. And so, again, the faculty and staff, we have 100% reporting. The students, they will be 100% reporting before they are allowed to attend a class, and classes start on the 23rd. So the students, of course, the numbers are trickling in slowly. But yeah, the big difference this year is, I mean, last year we were vaccines or masks and social distancing is really that's what we had. That was the tool we had. We're not mandating vaccines. We're strongly encouraging it. I can't mandate it for the students who are the ones who need the mandate, but the required weekly testing is it's a way of protecting the community, right. As well as, for people that are that view the vaccine as a hassle, it's a chance for them to weigh relative hassles. For people that have various other reasons for not taking the vaccine, that's fine. But that way we at least we're going to have very good information about even asymptomatic infections among the unvaccinated here on campus, and I'm hoping that that's going to help us. But again, the vaccine with testing as the backup is really the main approach.
Okay, thank you.
Yeah, I'm actually intrigued with what companies are doing. Some mandating vaccination. Some I heard this week are, if you're not vaccinated, if you're vaccinated and are out with COVID, if you're a breakthrough case, you're covered and you don't have to take time off if you get sick. If you're not vaccinated, you have to take time off. You're penalized with your time. So very interesting approaches to how you're dealing with employees. And obviously it made news. I'm sure others are doing this too, incentivizing, whether cash prizes, etc., to get vaccination. I mean, I like the creative thinking here. So, all right. Anybody else have anything to chime in on?
Hi guys, my name is LaToya Walker, and I'm new to the Columbia area. I moved here from the DMV about a little over 2 months ago, and it's really crazy how different it is from state to state and how each local government is handling this so differently. Just some people are allowing people to go about their everyday how they want, others are highly encouraging. Some people want to mandate certain things, and it just frustrates me how, the federal government can't take charge and just, try to make people want to do what's best for our country. And yeah, it's really hard on our economy. I work at Party Reflections. So, we do a lot of events and stuff like that.
Yeah.
And just the production and getting labor in here and keeping them in here because, people are getting sick and stuff like that. We have all this business on the books and you just don't know what's going to happen week to week with your labor and your staff. So we're committing ourselves, to these jobs. And it's just frustrating when, you have a week and half your staff is off, but you still have to meet the expectation of your clients. And that's probably, our biggest, it's a huge struggle, from the production side.
Business community thrives on consistency, right? The markets thrive on consistency. And for all of us, Hillary on our team hates me saying this, I'm sure, but we have to have contingency plans for contingency plans this week and next week and last year. It's triple the work, and we're all tired, and I get it's hard. So what if we continue these chats? What are some topics y'all want to? I mean, we can do the weekly wrap up type stuff, but is there anything that y'all want to see? If y'all missed hearing about that you want to hear from us about? Don't talk over each other. All right.
Carl, I will say what I always loved about joining these chats is there's some good information of what's actually happening, hearing it straight from people that are in positions that see what's happening on the streets day to day, and also have, power to make decisions and to influence things. You always did a fantastic job wrapping us up with some good fun things to send us off for the weekend to make it a little light when we left. So I always enjoyed that. It was a good mix of business, here's what's going on, and now let's move forward with a little bit of motivation. Not putting pressure on you.
Pressure on the closing.
We hear all these headlines about inflation, and I'm just echoing what Tara said. I think she said it very well, but understanding what that looks like in real life in the Midlands, again, I see it from my window and the business I'm in, but understanding what that really looks like out there, how some of those national trends are showing up locally, and are they showing up locally is something I'm always interested in learning about from my peers.
Okay.
Yeah, Carl, I've got this. I'm Jim Morris with the South Carolina Council on Economic Education. There's the health view and perspective, and then there's also the economy, the business owners, and of course, this organization helps represent a little bit of both, but it is the voice of the business. So I like to hear the cost and the downside of what's happening to business. I get a little. It doesn't take that much to figure out the health piece. That comes from every single. Open the newspaper today and yesterday and the day before. Facebook. And, everywhere. It's all about health. Yeah. Well, I'd like everything balanced with what about what's it doing to business? What's it doing to taxes? What's it doing for the evictions? There's two sides to the evictions. There's the pain and suffering of evicting somebody, and there's the pain and suffering for the many little moms and pops who are trying to pay their mortgages. Not everybody who has a rental home is a wealthy person. It's part of their savings plan. So, and then what happens to businesses when we do all the things? So I really want to hear a thread of what's happening to businesses with every single thing that talks about what's happening to health. So that's just me. So, because I don't hear that much. There.
Carl, okay. This is Lynn. I just quickly like to say, I think helping us on the front end of the positive growth in Columbia and the impact that it's having on the growth is having on just the city itself has been good to hear and understand.
We got a little bit of marginal growth, right? I'll find some encouraging thoughts on growth next week. It may take me a little while, Lynn. All right. So let's do this. Let's wrap up for today, and then we'll be back at it next week. Good thoughts. Hey, I've moved 1 out of 2 kids into Clemson this week. For those Gamecocks, sorry, but they need to get away, to fly away. I felt a little bit encouraged when, I laughed a little bit. We moved in on elevator on Wednesday with a lady from Arizona, and she goes, damn, I thought Arizona was hot. It was 116 where she left, and it was 95 in Clemson with about 96% humidity. She says, I've never been this hot before in my life. I chuckled. I thought that was hilarious coming from somebody from Arizona. But anyway, it is, make sure you drink plenty of water, wear your masks. We'll be back here next week, but we really appreciate y'all's partnership with the chamber and your feedback today. This is very helpful. So we'll see you next Friday, 9 o'clock. Have a good weekend. See you.